Please come on in. Thank you. So as we're walking in, I'm noticing, please have a seat. I'm noticing the patient's gait and range of motion. I'm going to go ahead and sit next to him for purposes of this video and spacing in this room so you can actually see me. Normally I'd be standing and he'd be on a much higher table. But anyway, I let him walk in so I can watch his neuromuscular functioning. Notice his cerebellum is intact. There's no wavering, disbalance, anything like that. And again, as mentioned, his gait, so I can see that it's all within normal limits. Okay. So, sir, can you please go ahead and tell me your name, your full name, and your date of birth?
Brian Kent Biggers, February 23rd, 1949.
Okay, what brings you in here today?
Annual physical.
All right, so by asking the patient those questions, I'm assessing his level of consciousness. He's alert, awake, oriented, knows where he is, date, everything like that. He seems pleasant, doesn't seem perturbed or anything like that, so in good enough mood. Okay, so today we're going to do this annual physical. I'm going to go ahead, I'm going to be laying my hands on you, assessing, doing a full head-to-toe assessment. If at any point you feel uncomfortable, have any questions, feel any pain or tenderness, feel free to stop me and let me know. Okay?
Okay.
So I go ahead and wash my hands, let the patient see that I'm washing my hands for hygiene, obviously to not transmit any type of transmittable infections. Okay? So we're going to go ahead and start with the head. I'm going to go move all the way down to the toes. If you go ahead and please remove your socks and shoes, please. So also by seeing this, I can see again more musculoskeletal functioning as he does that. All right, I'm also going to be assessing his skin throughout, assessing for any type of lesions, abnormalities, nevi that I would, moles, basically using the ABCD scale. Also for temperature, coolness, warmth, symmetry, things like that. That is going to be throughout the assessment rather than just doing the skin from head to toe at once. We're starting at the head, palpating his head, feeling for any lesions, looking for any parasites in the hair, any type of depressions, anything possible, signs of a traumatic brain injury. Notice that he does have some male pattern baldness. Hair is thin, but otherwise it is healthy, no parasites. The head is normocephalic, no lesions. So it's all within normal limits. Move on. I'm going to go ahead and take a look in his eyes. I'm going to go ahead and shine a light in your eyes in each eyeball. If you can go ahead and just look straight here at my shoulder. You can turn your head towards me. As he's turning his head, I'm also assessing his neck and range of motion. Notice that they are pearl. The pupils are equal and reactive to light and accommodation, both direct and consensual. If I had an ophthalmoscope, I would shine it in each eye as well, looking for the ocular fundi or the optical disc. Okay? By doing it, also assess his vision moving up and down. This would assess motor nerves as he's talking. I'd be able to assess more cranial and facial nerves. Okay? So moving on, I'd use that light, looking in his nose. If you mind tilting your head back just a little bit, I'd look in his nares, make sure the septum is midline, nares are patent. As I'm palpating, I'd be palpating his sinuses, maxillary facial sinuses, seeing if there's any tenderness when I'm touching you there.
Nope.
No. So the sinuses are clear. Also check his ears. Again, if I had an otoscope, I'd be looking for the tympanic membrane for it to be pink to translucent, looking for any excessive cerumen or drainage or any type of foreign objects. His ears are clear, tympanic membrane is clear to pink. They're all within normal limits. Also, noticing that he's having some of the typical aging, some hair coming out of them. The pinna, of course, are in line with the outer canthus, inner outer canthus of the eyes. So everything looks to be symmetrical. The ears are not low set or high set. Also, when I'm doing that, I'd be pulling up and back to take a look into the ear canal. Okay, moving on to his mouth, sir. If you don't mind opening your mouth for me. Good. Sticking your tongue out, lifting your tongue up for me. Okay, as I'm doing that, notice that his tonsils are +1 within normal limits. And notice he does have some pore dentition, There were some bridges there, a couple missing teeth, and some old cavities, some old fillings. His tongue is pink, mucosa is pink and moist, as well as the mucosa of his nose. The sclera in his eyes are white. Moving back to the mouth, on the ventral surface of the tongue, it's shiny with good vascularity there. No signs. You'd particularly be looking for any signs of cancer, any type of white spots or dark spots. Everything is within normal limits in his mouth. Also doing that, I'm able to assess more of the cranial nerves. Okay. Going to go ahead and move on. I'm going to feel for your lymph nodes here. Let me know if you feel any tenderness. This will be the the posterior chain. Do the occipital, the postauricular, the preauricular, tonsillar, the parotid, tonsillar, submandibular, moving forward, the submental, and then I would press here the superficial cervical, pressing deep the posterior cervical, the deep cervical, and then the supraclavicular. They all feel within normal limits, not really palpable, no swelling, no tenderness, anything like that. Do you feel any tenderness?
Nope.
Okay. So, that's all within normal limits. That's the head, ears, nose, throat, eyes. So we'll go ahead and move on to your thorax and your lungs. So, before I do that, let me also assess your carotid. On each side, assess your carotid pulse. Feeling for it. Strong, equal, bilateral, +2s. Would also assess using the bell of the stethoscope. Listen to it. Sir, if you take a deep breath in and hold it. Good. I'd be listening for bruits there. He has no bruits, but if there were, it would require a little bit further investigation because it's a possible sign of some aortic stenosis or some carotid stenosis particularly. Okay, so moving on to the thorax and lungs. You go ahead and listen to your lungs as you take a deep breath. You'll breathe through your mouth in and out. Each time you feel me move the stethoscope, just do a full breath in and out through your mouth. Okay? I would also, if you don't mind, go ahead and take your shirt off so I can see your back. So as I'm doing this, as he did on the face and his head, there, skin is at normal limits. It's warm. Assess at the back of my hand. Do that everywhere you feel. It's warm and dry. Noticing on his back, there are some nevi. None of them appear to be asymmetrical. The borders are all regular. Color is fine. Diameter is not larger than 6 millimeters, and none of them seem to be elevated. I would go ahead and take a deep breath in and out. Feeling for tactile firmitus. In and out. Good. I feel few different places. But also percuss the lungs. You can just breathe normally now. As I'm percussing, starting at the top, and moving down through the lobes, noticing that it is resonant in all 4 places. Now, when I move the stethoscope, we'll go as I said before. Starting the apex and moving down bilaterally. Excellent. So notice with that, he's got good vesicular sounds. If you notice of the right apex, just medial to the clavicle, there's also good bronchial sounds up there. Doesn't seem to be any distress. There's no adventitious sounds whenever I listen to it. Also go ahead and listen to him bilaterally. Lateral. You can go ahead and take a deep breath in. Good. Same. Good. Listening in the base of the lungs here. Good. Good. And as he's doing this, I've also noticed that his anteroposterior chest size is a 2-to-1 ratio for the transverse size, meaning it's 1 anteroposterior, 2 transverse. Okay. Sir, if you don't mind, go ahead and lay down here. I'm going to go ahead and assess your lungs from the top. Go ahead and assess your cardiovascular system and your abdomen.
Okay.
Okay. So when I first start kind of the base of the bed, and notice contour of the abdomen, chest. Abdomen is flat. Doesn't seem to be any type of lesions, abnormalities. As I'm feeling, it's good light hair dispersion, warm and dry as well. I'm going to go ahead and listen to your lungs first. Again, starting at the apex. Good. It's good vesicular sounds again. No adventitious sounds. Doesn't seem to be any distress. No dyspnea with breathing in. Of course, the sounds on inspiration are a little bit louder than the sounds on expiration, which is to be expected. Okay. So let's see. I guess that's pretty much it on those. You could percuss here as well, listening for resonance. And if I really wanted to, I could assess using the midclavicular line, coming down, figuring out where its liver begins, which is right there, right around the areola. Okay. So we're going to go ahead and listen to your heart. So I'm expecting the cardiovascular system. I'm going to go ahead and look at him with tangential lighting, looking to see if there's any type of pulsations, lifts, or heaves at the pericardium. There doesn't seem to be. All seems to be within normal limits. Sometimes you can see the left ventricle pulsation right below the nipple, but with him, it's not visible. So there are 5 spaces that we would go ahead and listen to: the aortic, the pulmonic, the Erb's point, tricuspid, and the mitral valve. So go ahead and start at the aortic, which is at the second intercostal space and the right sternal border. So we go ahead and feel for the intercostal space. There we go. Then the pulmonic is at the second intercostal space, the left sternal border. Moving down to Erb's third intercostal space, the left sternal border. The tricuspid down to the fifth intercostal space, and the left sternal border, and then the midclavicular line and the fifth intercostal space for the mitral valve. So noting his heart, it's a regular rate and rhythm. There doesn't seem to be any murmurs. I could listen to those same points with the bell, and particularly here for any murmurs. I'll go ahead and do that quickly. So no murmurs either. Again, S1, S2 present, regular rate and rhythm. Okay, so moving on to the abdomen. We already inspected the abdomen a little bit from the foot of the bed. You want to inspect, auscultate, percuss, and then palpate. Noting his abdomen has fine hair dispersion. There doesn't seem to be any. Go ahead and pull your pants down just a little bit below your umbilicus. His umbilicus is midline. There's no visible signs of any types of hernia. No pulsations, no peristalsis, no abnormalities. Skin, clean again, multiple nevi. A lot of patients have that. None of them are abnormal. Look for any type of striae or vascularity. None of that as well. So everything seems to be within normal limits. So next I'd go ahead and listen to it in 4 quadrants. Listen for vowel sounds. Patient has active bowel sounds, verging on the sign of hyperactive bowel sounds in all 4 quadrants. The hyperactivity, I'd probably ask a little bit more in depth about his bowel pattern. but it seems to be pretty close with the normal limits. I'm going to go ahead and lightly percuss. So again, you're percussing up and listening for tympany and then dullness once you hit the liver. Percuss in a couple other places for spleen, listening for tympanic sounds, and then I would go ahead and palpate with light palpation first in each of the quadrants, noting any areas of tenderness or discomfort watching the patient's face, and then go a little further with deep palpation. Some liver is actually palpable, some livers are not. And in each quadrant, I would be noting different things. So in his right lower quadrant, you know, the appendix is, you've got the appendix there. In his right upper quadrant, you have most of the lobes of the liver. In his left upper quadrant, you've got your spleen and your pancreas, body of the stomach, and then in the left lower quadrant, got the descending colon and the cecum. Everything seems to be within normal limits. Was there any tenderness or pain when I was touching you there? No. Everything felt okay. Everything sounds okay and feels okay with that. Go ahead and move on to his peripheral vascular system. So, sir, can you hand me your arms real quick? Good. So as he's handing me his arms, go ahead and grip and squeeze. So this is not necessarily peripheral vascular; it's more musculoskeletal. I notice strength is equal and even. He doesn't seem to have any discomfort or any pain as he's moving out. I'm noticing he's got, again, strength is equal. Skin color is normal. You can relax your arms and your hands. I'm going to go ahead and look at his fingernails, looking for capillary refill, which is brisk. It's less than 3 seconds in all his capillaries. I'd feel bilaterally for his radial pulses. They're +2s, equal, and also for his brachial pulses. Again, looking at the skin, no lesions. Everything seems to be within normal limits. It's got good vascularity, good cap refill. So I'd also go ahead and move down his legs. You could feel the popliteal pulses. If I wanted to, I could also feel or listen to his femoral pulses while or just after inspecting his abdomen. Moving on down for his posterior tibial pulses, +2s, equal, regular rate and rhythm, as well as so with the arms. For his dorsalis pedis pulses, +2s. Notice his toenails. There's some little bit of he's got his larger toenails. They're, I wouldn't say healthy, kind of discolored, but the capillary refill is equal, it's brisk. So can you go ahead and wiggle your toes for me? He's wiggling this, again, this is neuromuscular functioning. I would go ahead and push, like car pedals, pull, good, lift, both of them, good. So he's got good musculoskeletal functioning there. Notice any pain, anything when I'm touching him, poking, I would be poking for him, especially along the bony shin part, looking for any type of edema, as I would in his upper extremities as well. Notice that there is no edema whatsoever, so no swelling. I do notice this patient does have a history of diabetes, so I would also encourage him about his foot care. And again, as I mentioned, the toenails, they're a little bit brittle and discolored, so just go ahead and further inspect that and discuss that with him. For the most part, we are done with your physical assessment. You can go ahead and put your shirt back on. Of course, throughout this entire thing, I'm watching for the patient's comfort level, comfort or discomfort, making sure that I'm ensuring his privacy, and didn't seem to have any discomfort. At the end, also ask if he has any questions, if there's anything further we wanted to discuss, any type of abnormalities that I found in there, we'd probably inspect further, discuss what we might need to talk about. Like I said, the bowel sounds, his feet, history of diabetes, things like that. Sir, do you have any questions?
No.
No? Feel all right?
Very good.
For the most part, I give you a good bill of health.
Thank you.
All right. Thank you very much, and have a good day.